Good afternoon, ladies and gentlemen. I'm Dr. Subrat Das, and I'm one of the internal medicine residents at the Icahn School of Medicine at Mount Sinai. And this is our team, EZ-Cardiogram. So the problem we are tackling here is that present-day computer interpretation of the EKG is not very reliable, and physicians do not trust them. This is primarily because we frequently get incorrect readings, especially in edge cases like arrhythmias, and it's difficult to trust that. Then also the algorithms being used is very device specific. They are deterministic and proprietary. So there is no real way to kind of compare the algorithms. And this often leads to the EKGs being referred to cardiologists, which is time consuming, and it often delays patient care. The solution we are proposing here is to enhance the accuracy of the computer interpreted EKGs by using machine learning image analysis. The key over here is the approach to use image analysis, because this kind of makes us use this analysis over independent of all the devices and machines. Moreover, we are using the deep learning technology so that we are going to learn from the real world EKG data, and it is going to evolve and learn and become more and more accurate as we use it more. This will eventually lead to decreased kind of reliance on the human expertise to analyze the EKG. This will free up the physicians to spend more time with the patients, which is the real key value that we're adding in here. To get into more, I'll hand over the mic to Cole.
Thank you very much, Subrat. So just to explain how the product would actually work, it would be a mobile application, and the user, whether they're a physician or someone else on the care team, would snap a photo of the EKG. It'd be run through a machine learning analysis, and it would output the likely interpretation. These are 6 categories that we were looking at for our initial prototype. And while there are some competitors on the market that do read 12-lead EKGs, which are critical for clinical care, this is the first to market that does the image-based EKG analysis. And again, this is critical because it allows you to interoperate with any device. It's not machine-specific, and it doesn't require any additional overhead or infrastructure to install. Additionally, it continually learns over time as it is exposed to more data. So what we've done so far is we trained a CNN model with transfer learning. We tested 2 data sets. One is a 12-lead data set, and one is a 1-lead data set. For the 12-lead, where we had the smaller data set, we were able to get 46.7% accuracy. For the 1-lead data set, where we had a much larger data set, we were able to get 92.6% accuracy. So again, this really shows as we get more data, we think we can get this to be really accurate. Looking at our market strategy, we view our target market as hospital systems and practice groups in the US. We see this as a $300 million a year opportunity with the potential to expand to other markets, whether in other geographies or other decision support tools. Our go-to-market strategy will be to find co-development partners, which we can work with them to expand our data set, file for regulatory approval, and roll out to pilot sites. Based on our annual licensing fee, we expect to generate around $30 million per year in the US market within 5 years of launch. So just to conclude, our AI-based system will help reduce physician burden, improve patient experience and care. This is our team. Thank you very much. Happy to take any questions.
I love the fact that you actually trained a model and tested it. Again, it's hard to do in the hackathon, so great work doing that. I think the basic proposition, a lot of us agree with, that AI interpretation of EKGs can exceed existing automated methods. I guess my question for you, though, is knowing that there are other companies pursuing this, and that the major barrier to succeeding in this is getting data. Like, what's your proposal for, I guess, getting initial traction?
So essentially, this is one that we tested on like open source databases that we have. But the idea is that once we partner with like the early adopters, we'll have a data set that is curated and read by cardiologists, and they're like profiled by, let's say, 3 cardiologists or 5 cardiologists, and we'll run that data set on our model and then use that to go to more validation data set. So that is the plan ahead. And this is in relation to, like, this is the industry standard. Like, you can talk about Google doing AI learning on diabetic retinopathy, and that's what they use. They used a specific data set from the open source as well as a curated data set from 3 sites, and they kind of stratified it based on the different ophthalmologists they're trained to read it, and based on that they trained it, and they got really good results. And we're very hopeful, based on the open source database we have, we're getting really good results for a 1-day training.
Also, we can use our initial data sets to generate synthetic data to increase the statistics and bootstrap the process.
So Is this confirmed? So are the results confirmed by cardiologists at the end?
Are you talking about this data set or like?
No, just the when it's used, when the product is used.
Yeah, so like for this present data set, is, we got it. These are like all labeled data being read by cardiologists, and we run it on this data set. So when we are going to do with the partner model, we're going to like get an EKG, run it through the cardiologist by panel of 3 to 7 cardiologists, and use the labeled data to tune our model to
Got it.
act better.
Okay.